Today, we're looking back at stories we've done that address health, either problems that need to be addressed or innovative solutions being implemented in our region. Our first story is about a virtual food desert right here in Northwest Indiana. Once a year, the nation celebrates National Farmers Market Week. Federal officials celebrated this year by boosting the number of markets that accept the Supplemental Nutrition Assistance Program, or food stamps. That's especially important in Gary because of an absence of fresh goods and an abundance of food deserts. Reporter Hillary Powell talked to community leaders trying to ensure food equality by getting affordable, healthy food to all Lake County residents.
The block at 15th in Massachusetts, once boasting the John Stewart Settlement House, a 20th century safe haven for African American migrants, is now a place where fresh food is rarely found.
This is a food desert.
It's bad when you don't have a grocery store nearby, because then some people older don't have transportation, can't travel, or transportation don't go to certain areas. And then for a grocery store, if you do take public transportation, you're limited to what you can buy.
A 2012 study from the Northwest Indiana Regional Planning Committee shows 20 Northwest Indiana areas meet the United States Department of Agriculture's definition of a food desert. Hefner is trying to make a difference on this corner. As a trustee at Christ United Methodist Church, he volunteers to grow crops at the church's Stewart House Urban Farm and Gardens, named after and placed in the same spot as his first Gary home.
Although we don't have the building anymore, it's just history.
From a pastoral point of view, I think what the Stewart House once was for the African American community was to bridge the gap. Nice tomatoes. It is hollow ground. A lot of the families that are members of Christ Church now, their ancestors came through Stewart House. Now we're doing this gardening project, and it will serve still the community as it did before.
Delivering fresh vegetables to parishioners and neighbors.
We had one of the people out here the other day who had just cut some cabbage. And there was a young lady walking down, and he asked her, "Do you want some cabbage?" And then he gave them to him, and then she says, "Now what do I do with them?" People need to know what to do with some of these veggies out here.
This is a pineapple.
Very good.
Across town, at a new farmers market on the campus of Methodist Hospital, some young residents are getting an education in nutrition.
So that they can learn that everything doesn't come from a can.
Darlene Terrell is a child care provider in Gary.
I grew up right here in this neighborhood.
Who says fresh produce is hard to find near her business.
No, not fresh produce like this is not easy to get. So when you see it, it's like, oh yes, we got to go and experience it.
Reach in there, get a handful, and I'll fix them for lunch.
This farmer's market was her classroom today.
We eat healthy snacks, so when we get back, we're going to take the fruits and vegetables that they purchase, and we're going to combine them, and we're going to wash them, and we're going to eat them for lunch.
A 2012 NERC study shows Lake County has higher food insecurity rates than both the state and nation, with 18% of residents living in a food desert. USDA Undersecretary Kevin Concanon says more farmers markets across the state are accepting Supplemental Nutrition Assistance Program, or SNAP, to fill a gap.
It encourages people to buy fruits and vegetables locally grown, less processed, and two, it puts dollars back into those local economies in the form of farmers.
It does take a car to go to my grocery store.
Shoppers say proximity makes a difference in healthy food options.
There needs to be a place where people can just walk in and get healthy food.
Local experts say the community has responded when given a chance to get fresh goods.
We had over $3,000 worth of product, and we sold more than 75% of what we had.
Okay, the food is fresh and it's healthy.
All right.
Save some water, Earl.
People were able to get food from here, and this is what we're trying to recapture in a small way.
You got some squash.
It was holy ground then. Is it still kind of reverent now?
Yes, I believe so. I would say so.
More information about area farmers markets and the Stewart House Urban Garden can be found on our website, lakeshorepublicmedia.org. Access to healthy food is one litmus test of a healthy community. Another is a community's ability to proactively work to help prevent the spread of disease. A clinic in Northwest Indiana is hoping to give more residents a chance to stay STD-free by focusing on education and prevention.
Information, any contact numbers you need.
It's an ominous list.
Gonorrhea, chlamydia, trichomonas.
And East Chicago health officials want to replace this catalog of some of the region's most contagious communicable diseases with a better checklist.
They give you like information on STDs and how to prevent it and your chances of getting it if you're not using protection. Okay, I know what to look for. I know what not to do. I know where I can go get help if that ever happens.
A recent ribbon cutting for a new clinic to test for sexually transmitted diseases at the East Chicago Health Department is an answer to calls.
Yes, ya tengo el estudio.
After the clinic ended primary care services, residents called to ask for testing.
Gary and East Chicago are the only two cities left in the state that actually have health departments. Some physical fitness and nutrition type grant services that were discontinued. So we converted them to this opportunity with the state to have a formal STD clinic. We've taken those grant dollars and hired a nurse.
The state money will also fund a stock of antibiotics. It's a unique way to tackle an all too common concern in the region, STDs. A May 2014 report from the Indiana State Department of Health shows Lake County, Indiana has the second highest rate of HIV-related deaths in the state.
Still large amounts of chlamydia and gonorrhea that go undiagnosed and untreated.
Nearly 2,700 cases of chlamydia were reported in Lake County in 2013, one of the highest rates in the state, fueled by stigma and silence.
I believe they know of it, but they're either too scared or too embarrassed to come in the facility to get tested. They know it's there. They're like, oh, if I walk in, then they think I have something or they're gonna label me.
The new clinic wants patients to walk in and get checked out.
We're not here to judge. We're here to help and prevent and to educate. We want to bring in adolescents. We target 15 to 24, ages 15 to 24, where sexual activity is more prominent.
Experts say this tiny keychain can make a big dent in dismal disease rates in the region. Clinic workers hand them out and say condom keychains can make safe sex practices portable, discreet, and help combat largely preventable diseases.
If you have a sexually transmitted disease, that makes you more susceptible to HIV infection. And so that's still quite a problem in the African American and Hispanic community, and most of our patients are of those ethnic backgrounds.
State research shows if you test, people will come. African Americans have the highest share of HIV tests in the state at 60%. The clinic hopes to offer HIV testing in the coming months, but Browning says all STD screenings save lives.
We'll be able to make some inroads in lowering that risk factor by having the accessibility for diagnosis and treatment for those more simple diseases.
Have condoms.
Edwards is pleased with the safe sex goodie bag she's leaving with.
Discreet, no one knows but you.
But education is perhaps the greatest takeaway.
Go get screened. Never be scared. It's your life. You only get one body. Take care of it. Get checked. Do it.
The clinic is open to East Chicago residents and people living in surrounding communities. Patients need only bring an ID. It's a program designed to make sure that the tiniest patients, the most fragile and helpless among us, have access to a precious resource. Now it's easier than ever for residents of Northwest Indiana to help make sure that precious resource is available.
It all began with an idea from lactation consultant LaVon Souther, who works at Crown Point Obstetrics and Gynecology.
I came to the two owners of the building, and they're both physicians and owners of practice, and I said, so I want to open a milk bank. And Dr. McCormick's response was, absolutely. Not how, not why, not when, not how much. Absolutely.
A milk bank or milk depot is a drop-off site where pre-screened mothers like Plant can donate breast milk, which is often used to feed sick or premature infants. The Indiana Mother's Milk Bank operates several drop-off sites throughout the state, but this is the first location in Northwest Indiana.
It's huge because it's a target area we're looking at for Indiana. We see a huge gap where we know there's a need, so this was perfect when we got the connection with Lavon for here, so it was like, yes.
During a recent launch party for the Milk Depot, local caregivers spoke about the benefits of breast milk for infants in the Neonatal Intensive Care Unit, or NICU. Kelly Thompson works with newborns at St. Anthony Hospital in Crown Point. She says unlike formula, breast milk has antibodies and immunities that can help prevent infection and reduce time spent in intensive care.
In the NICU, you will hear many doctors and nurses refer to breast milk as liquid gold, and that's because that's exactly what it is. It is liquid gold for these premature babies.
Breast milk essentially isn't a live substance. It's alive, it's living. Under a microscope, you look at breast milk and it has little cells running around killing off bacteria. You look at formula under a microscope and it's dead. So that's why that goes off. There's nothing to kill off bad bacteria. So this is why breast milk does survive a lot longer.
Long says for now, the biggest obstacle is often educating the public about the safety and benefits of donated breast milk.
Even breastfeeding mothers, some people have never heard of donor milk. If they have, they've heard about it as milk sharing, but they don't realize that as a milk bank, we're non-profit, and it's pasteurized donor human milk that's all done, and it's safety, it's effective. So we follow the same guidelines that are very similar to a blood bank. It's kind of approaching the physicians with the research. There's a lot of research out there to support the use of pasteurized donor human milk and the safety and efficacy of that. So really it's just getting in there and talking to the physicians, you know, re-educating. They may not even know about it. They may not even understand fully how safe it is. So that's a lot of our work really, primarily.
Government officials have been hard at work this year uncovering and addressing mismanagement at the Department of Veterans Affairs. The confirmation that some patients have died waiting for help prompted lawmakers and public alike to re-examine the care veterans are receiving and, in particular, the length of time vets have to wait to receive it. Lakeshore reporter Hillary Powell explored how long local Hoosier veterans wait when seeking services in the region.
It was an unexpected call, but not an unwelcome one.
Right before you contacted me, you know, I received a call. Now, normally I would never receive a call, never receive a call to tell me that, hey, we are overbooked. Is it possible for us to reschedule your appointment for a later date?
A May 19th call from a scheduler at the Veteran Administration's Adam Benjamin Outpatient Center in Crown Point shook up the regular routine. 40-year-old veteran Devon Edwards says he expects when booking appointments.
We're overbooked. This is the number one response I get. And they know this is a frustration with many veterans. Many veterans are frustrated with the overbooking.
Oh, that's a surprise to me. Veterans from this clinic?
Yeah.
Okay. I would have to see the circumstances. That's unusual. I'm surprised to hear that, actually.
Clinic Director Jill Carley says she is unaware of extended wait times at Adam Benjamin for the 13,500 veterans who are served at the primary care facility, an outpatient center for Chicago's Jesse Brown VA Medical Center. Carley says each new patient is seen within 14 days.
At the Adam Benjamin Jr. VA Outpatient Clinic, we have no patients who are waiting longer than 14 days. All new patients are seen within 14 days, and we do not have any wait list here at this clinic. And we don't anticipate any problems with that because we do have enough staff.
But one fact seems unanimous from the VA. Delays in care for veterans are universal, system-wide. This from a May 28th report from the VA Office of Inspector General that found, quote, inappropriate scheduling practices are systemic throughout the VHA.
Do you think that that's the case at this facility, or because they're saying systemically it's an issue?
Yeah, it would be inappropriate to comment about that, but at this clinic it is not an issue and it is not a problem.
Edwards says long wait times for even routine services are a given. He says he waited more than a year starting in 2013 to book a dentist appointment at Adam Benjamin.
I was like, yo, I'm trying to get this appointment. And it's like, man, it's like I'm waiting 30, 60, 90 days for an appointment. And I was like, are we that busy? I was like, well, why do I have to go through so much through the VA system? I joined prior to me graduating.
The Cherville-based veteran spent 17 years serving across 3 branches of the military.
I loved serving my country. That would be me right here. That's your boy.
His daily health battle with lupus and kidney disease are reminders of the only reason Edwards quit, a medical retirement. After his conditions were declared as 100% service-related, he started attending Adam Benjamin in 2008. After his scheduled appointment for the dentist was delayed, he sought help from the clinic's patient advocate, a position Carly says is a check and balance for VA violations like long wait times.
I told this to the patient, the rep, and she called on the phone, and the person I had an issue with, which really wasn't with her, it was just with the scheduling system.
A new appointment was set and met, but Edwards says the latest call he received was the result of VA audits nationwide, which have found inappropriate scheduling practices are used to hide long wait times for thousands of veterans, including at one facility in southern Indiana. In a statement, VA Public Affairs Officer Kevin Harris says there were no major findings from recent face-to-face audits at Adam Benjamin.
There's a hotline number to report suspected wrongdoing at VA clinics, 1-800-488-8244. We'd also like to hear about your experiences with the VA on Twitter at Lakeshore Report or via email at news@lakeshorepublicmedia.org. The concerns about the care being given to our nation's veterans prompted Indiana State Senator Joe Donnelly to ask for a meeting with the nation's top Veterans Affairs leader. It's a request he penned in a letter to the Department of Veterans Affairs after reports surfaced in May that wait times for patients at a VA clinic in Arizona were life-threateningly long. VA Secretary of Affairs Eric Shinseki resigned in May after a report from the VA's Office of Inspector General found problems with delayed care and off-the-books waiting lists in VA clinics across the country. In an interview at that time, Steve Walsh spoke to the senator about his demand for answers and the well-being of Hoosier veterans.
U.S. Senator Joe Donnelly has been in the news recently. His first bill to help prevent military suicide was just made part of the Defense Authorization Act. He, along with Senator Coates, is also requesting a sit-down with the acting head of the VA to address national concerns over long wait times at the VA. Senator, welcome to the show.
Thank you so much for having me with you.
So originally you sent a letter to the VA saying that you wanted answers to see whether or not these long wait times were happening in Indiana, and now you're requesting an actual face-to-face meeting. Are you not getting answers from the VA?
Well, we have not heard back yet. We sent the letter to General Shinseki, and obviously he's no longer there. Senator Coates and I have not heard back, and so we want a face-to-face meeting. But what I've done in the meantime is I've personally gone out and started visiting all of our, I visited all of our veterans places on a constant basis, but just in the last week I went to the Northern Indiana Region Director's location. I've gone down to Indianapolis as well to check through wait times, to check through records, to check through all these things to make sure that Indiana's veterans are being properly cared for.
And what are you hearing from veterans? Are you seeing evidence that some of these long lines? Because we've had vets on the radio, and there are some long wait times out there.
There are some long wait times, and we're trying to knock them down right now. What we've seen is that some of the wait times in Indiana are not at 14 days. They've extended out longer. But what we have not seen at all is there has been no manipulation of any of the wait times or any of the records. We've been fortunate so far that everything that's been there has been reflective of exactly how it is. And we have to be able to make sure that we can get our veterans through the system quicker. The care that's being given is very, very solid care. Our veterans are very positive on the care that they receive, but it's just the bureaucracy of being able to get the appointment that's been the difficulty.
We had a retired Army officer on who said the solution is to open up the system, make it more like Medicaid. You can go to any doctor you want rather than wait for a VA doctor. Do you think that is part of the solution?
You know, that can certainly be part of the solution. I have no objection to that. For a long time, though, the veterans have taken great ownership and great pride in the VA healthcare system. And so for our veterans, it is something where they have specialty needs like PTSD, being able to get certain other things like Agent Orange related issues, that we have specialties in the veterans health system that we are probably better at than anybody in the world at trying to help solve these problems. So I don't have any difficulty with having the system also reflect that if somebody wants to go to a private doctor, that they can do so.
Your first bill to help prevent military suicide, named after Jason Sexton, who was a National Guard member who committed suicide back in 2009. That's now part of the Defense Authorization Act. It seems very likely to pass. Do you think the military has a better handle now on suicide?
Well, we're certainly working to make sure that they do. They are aware of how important this is, how critical an issue this is. For instance, Steve, just in 2013, we lost 118 young men and women to combat, and we lost 470 young men and women to suicide, and that is both in theater and back home as well. So 4 times the rate of soldiers lost in combat that we lost in suicide. So they know how important this is, and what our bill does is it makes sure that every member of the military, whether active duty or guard or reserve, is able to get an individual mental health screening each year, and that it be kept completely private so that they're comfortable to go get it, that they are not concerned about whether or not it's going to affect their ability to be promoted or to be able to stay in the military. So we're trying to make it so that the services are readily available.
And Senator, I wish we had more time. Unfortunately, we're going to have to wrap it up there. Senator Joe Donnelly, thank you so much.
Thank you so much. Thank you.
We want to thank you for joining us for this special Lakeshore Report Focus on Health. We hope to see you next week when we'll be back with our regular Lakeshore Report.
Hi, joining me for this edition of Eye on the Arts is Kirk Muspratt, Music Director of the Northwest Indiana Symphony Orchestra. Welcome back, Kirk.
Happy holidays, John.
So you're gonna promote the big Holiday Pops concert today.
I surely am.
Yes. 3,000
people last year.
Yeah, are we gonna beat that this year?
Absolutely. Get your tickets now.
I hope so. Well, everybody always loves the variety of music that you select for this concert.
Oh, thank you.
And so what's on score this year?
Well, you know, what we try to do is it is a holiday pops concert. So we want to welcome everybody and have all kinds of music. So there's certainly sacred music, like we're doing Ave Maria, we're doing the Lord's Prayer. But we're also doing music that's a little more secular, but the good feeling, like Let There Be Peace on Earth. And then we go all the way to this year. I finally got the music to I Saw Mommy Kissing Santa Claus, and a Bing Crosby arrangement of I'll Be Home for Christmas. So hopefully there's tremendous range of music for everyone.
But the 10 Commandments.
Yes.
Wow, that's the wrong testament.
It's okay. It's fantastic music. I've been working with Elmer Bernstein's son, Peter Bernstein, to get the music to Kill a Mockingbird that I would really love to do this summer if we can. It's such a great movie and such beautiful music. So as I was talking to him, we could never get the music to 10 Commandments, and he finally has let us have it. So if he let us have it, I'm going to grab it, you know, and it's gorgeous orchestral music. So.
And you have the right kind of hair for Moses, too.
I do.
Yes.
Unfortunately, not the right character yet, but.
Right, okay. So we, as you said, we almost sold out last year. People should get their tickets as fast as they possibly can to get good seats.
Absolutely.
They're all good seats, though.
Yeah, Star's great.
I've sat up in that very back, highest nosebleed row, and it's fine.
Yeah, it's a wonderful feeling, though, because people say to me all the time, Kirk, our holidays don't begin until we've come to this concert. I hear it over and over. So it's a community family.
So December the 11th.
Yes, Thursday evening.
And then the next night, a repeat up in Crystal Lake.
At the Rao Theater,
yeah,
which is also sold out always.
a whole other audience. Okay, well,
Yeah.
good luck with the concert.
Thanks, John.
Thank you for watching, and we'll be back again next week with another edition of Eye on the Arts. Eye on the Arts is made possible in part by South Shore Arts, the Indiana Arts Commission, and the National Endowment for the Arts, a federal agency.